Vancouver General Hospital's emergency department is one of the largest and busiest in the province. As a Level 1 trauma center, the 200-plus staff members and doctors who work there see everything from minor injuries to the most seriously ill people, providing care for more than 95,000 patients per year. As you'd expect in a busy ER, the environment can be stressful, and staff face more than their fair share of difficult situations and incidents, including aggressive or violent patients.
There was a couple of incidences that were happening to our staff, and one was quite serious, where a physician was punched in the face by one of our patients. And we really realized that this wasn't just an occurrence that happened once in a while. There was a violent environment for our staff. What we became really aware of was that our staff didn't know of the supports that were in place after these incidents happened. There was a high turnover of staff and people were feeling quite disengaged. We knew there were some kind of deeper issues that we needed to look into and see what was really happening. What was actually the workplace environment like for our staff and physicians?
In February 2016, Vancouver General Hospital's Healthy Workplace Initiative kicked off with a survey to identify the main issues, which included physical and psychological safety, leadership support, and violence prevention and critical incident response.
I think the first and probably most important step was the survey process, and it was a really in-depth survey that allowed our staff and physicians time and space to really articulate what their thoughts are about working in the emergency department and what their barriers were and what they thought needed to happen.
Visioning exercises and weekend retreats were held for staff and physicians to foster a sense of team and belonging, and a new leadership structure was introduced to make leaders more accessible. Weekly violence prevention exercises and critical incident stress management group debriefings were organized to reduce violent incidents and ensure that anyone witnessing and experiencing such incidents is provided with immediate support. An innovative Stop Violence campaign was launched, featuring life-size posters of staff and physicians who have experienced violence. The posters, which encouraged reporting, have contributed to a 64% decrease in violent events.
Staff's voices were a big central part of the solution, and that really turned it into an environment where people wanted to be at work in the VGH emergency department. That decreased our sick rate and decreased our turnover, and now we're really happy to say that we have a lineup of people wanting to apply to the VGH emergency department.
I believe this team deserves this award because they were willing to be vulnerable and they were willing to do things differently. And they really put all their focus into supporting our staff, and that's what really made a difference.
For tackling a difficult challenge head-on and engaging all stakeholders in developing solutions, we award the Gold Apple in Workplace Health Innovation to Vancouver General Hospital's Healthy Workplace Initiative. Generously sponsored by Healthcare Benefit Trust.